Optometrists play a vital role in eye care by examining, diagnosing, and managing visual disorders and ocular diseases. Their work involves performing comprehensive eye exams, prescribing corrective lenses, and advising patients on eye health. A career as an optometrist requires precision, analytical skills, excellent communication, and a genuine commitment to patient care. Employers look for candidates who combine technical expertise with strong interpersonal skills. During interviews, highlighting your clinical experience, knowledge of ocular conditions, and ability to communicate complex information clearly can set you apart. This video presents common optometrist interview questions, sample answers, and practical tips to prepare candidates thoroughly for interviews. Understanding the role of an optometrist. Optometrists are responsible for assessing visual acuity, diagnosing eye conditions, prescribing glasses or contact lenses, and managing ocular diseases. They often collaborate with ophthalmologists and other healthcare professionals for advanced care. In addition to clinical duties, optometrists educate patients on eye care practices and preventive measures. Employers evaluate candidates on clinical competence, problem-solving skills, patient interaction, and the ability to stay updated with advancements in optometry. Demonstrating both technical knowledge and empathy during interviews reflects your readiness for the role. Question 1. Can you describe your experience as an optometrist? Here's how you can answer. I have worked in both private clinics and hospital settings, conducting comprehensive eye exams, diagnosing visual disorders, and prescribing corrective lenses. I have experience managing patients with common ocular diseases such as glaucoma, cataracts, and dry eye syndrome. Additionally, I have collaborated with ophthalmologists for referrals and advanced care, ensuring patients receive comprehensive treatment. Tip: emphasize clinical experience, types of patients handled, and collaboration with other healthcare professionals. Specific examples of cases managed successfully strengthen your answer. Question 2. How do you perform a comprehensive eye exam? Here's how you can answer. I start by reviewing the patient's medical and ocular history, followed by assessing visual acuity using standardized charts. I conduct refraction tests, check ocular alignment, and evaluate the health of the anterior and posterior segments using slit lamp and ophthalmoscopic examinations. I also assess intraocular pressure to screen for glaucoma. Based on findings, I provide recommendations for corrective lenses or further investigations. Tip: demonstrate systematic and thorough clinical assessment. Mentioning specific diagnostic tools or techniques shows technical proficiency. Question 3. How do you handle difficult patients or those with high anxiety? Here's how you can answer. I approach anxious patients with empathy and clear communication. I explain each step of the examination process, address their concerns, and ensure they feel comfortable. I maintain a calm and reassuring demeanor, allowing the patient to cooperate and gain confidence in the care provided. Tip: highlight communication skills, empathy, and patient management. Employers value candidates who can provide care while maintaining patient comfort. Question 4. How do you stay updated with advancements in optometry? Here's how you can answer. I regularly attend workshops, webinars, and professional conferences. I read journals such as Optometry and Vision Science to keep abreast of the latest diagnostic techniques, treatment protocols, and technologies in eye care. Staying informed ensures that I provide evidence-based care and utilize the best practices available. Tip: emphasize commitment to continuous learning and professional development. This reflects dedication and adaptability. Question 5. How do you diagnose and manage common ocular conditions? Here's how you can answer. I diagnose conditions like refractive errors, glaucoma, cataracts, and dry eye through thorough examination and diagnostic tests. Management may involve prescribing corrective lenses, recommending lifestyle modifications, administering medications, or referring to specialists when necessary. For instance, glaucoma patients are monitored regularly, and treatment plans are tailored to their specific needs. Tip: Highlight clinical expertise, patient-specific management, and ability to make informed decisions. Specific examples of past management enhance credibility. Question 6. How do you ensure patient compliance with prescribed treatment? Here's how you can answer. I educate patients on the importance of adhering to their treatment plans, whether it involves wearing corrective lenses, using prescribed eye drops, or attending follow-up visits. I provide clear instructions, address any concerns, and use reminder tools when appropriate. Building trust and explaining the consequences of non-compliance helps patients follow recommendations consistently. Tip: emphasize communication, education, and relationship-building skills. Patient adherence is a critical aspect of effective care. Question 7. How do you handle emergencies or unexpected findings during an eye exam? Here's how you can answer. If I encounter an unexpected finding, such as sudden vision loss or signs of retinal detachment, I act promptly by stabilizing the patient and arranging immediate referral to an ophthalmologist or emergency care. I document the findings thoroughly and communicate clearly with both the patient and specialist to ensure timely intervention. Tip: highlight quick decision-making, clinical judgment, and collaboration with specialists. Employers value candidates who can handle critical situations calmly and effectively. Question 8. How do you communicate complex eye conditions to patients? Here's how you can answer. I use simple, non-technical language and visual aids when explaining diagnoses and treatment options. I ensure patients understand their condition, the purpose of prescribed treatments, and potential outcomes. Encouraging questions and confirming their understanding helps patients feel informed and confident in their care. Tip: emphasize clear communication and patient education. Effective communication is essential for patient satisfaction and adherence. Question 9. How do you manage multiple patients in a busy clinic? Here's how you can answer. I prioritize patients based on the urgency of their conditions while ensuring each receives thorough attention. I maintain a structured schedule, communicate expected wait times, and delegate tasks such as preliminary tests to support staff. Efficient workflow management ensures timely care without compromising quality. Tip: demonstrate time management, organizational skills, and teamwork. Employers seek candidates who can maintain efficiency under pressure. Question 10. Why should we hire you as an optometrist? Here's how you can answer. You should hire me because I combine strong clinical expertise with excellent patient management skills. I am committed to providing high-quality eye care, staying updated with advancements, and educating patients on eye health. My experience in handling diverse cases, managing emergencies, and collaborating with healthcare teams ensures that patients receive comprehensive and professional care. Tip: summarize key strengths: clinical competence, patient interaction, adaptability, and commitment to ongoing learning. Make your answer concise and persuasive. Final thoughts. Optometrist interviews assess both technical proficiency and patient care skills. Demonstrating a solid understanding of clinical procedures, patient management, and effective communication will help you stand out. By emphasizing your experience, continuous learning, problem-solving abilities, and dedication to patient outcomes, you can convey that you are prepared to excel in this role. A combination of clinical expertise, empathy, and organizational skills will increase your chances of securing the position and contributing positively to the clinic or practice.